thought it'd be interesting just to kind of go through a little bit of the history of Hipec and cytoreductive surgery as well. So the use of heat to kill cancer cells actually dates all the way back to the Egyptians in 5000 BC. They found that if they burned tumors on the skin, that sometimes the tumors did not come back. And all the way dating back to the 1930s, tumor debulking was first described for ovarian cancer. And that's where a lot of the debulking operations really started to take off, was for ovarian cancer. In 1980, Dr. Spratt was one of the first to introduce the idea of Hipec, and he actually treated patients with heat and chemotherapy using a perfusion device. And this showed that the control of cancer was best achieved through a combination of not just heated perfusion, but also with chemotherapy. In the 1980s and 90s, Dr. Sugarbaker, who's a very famous surgeon, often considered the kind of father of modern day Hipec, started to explore this outside of ovarian cancer and started to look in GI cancers. He started with gastric, but then we expanded it to different cancer types, like stomach or colon. He developed ways to score the abdomen and to be able to communicate between surgeons about the burden of disease. And he also went on to publish several papers on how to do what's called a peritonectomy, removing that saran wrap or lining of the abdominal wall in order to remove the bulk of the tumor. And then now, really research is focused on identifying which patients will derive the greatest benefit from this type of treatment through clinical trials, lab work, retrospective studies, all focused on reviewing charts in order to both expand who we can use this treatment for, but also narrow down the window of who's going to derive the most cancer benefit from it.